Today I'm going to talk about recurrent vomiting and ginger. In Chinese medicine, ginger is a important herb for vomiting, and it really depends on the classification of the vomiting. So there are a lot of patients who have frequent vomiting for unexplainable reasons. There are a lot of different things in Western medicine that we are able to identify that causes recurrent vomiting, but there are also a lot of patients who just have recurrent vomiting and they can never get a clear answer as to why it's happening or what triggers it. Sometimes people think it's related to the foods they're eating or seasons or the time of year. It could be a whole host of things, but oftentimes it's very difficult to pin down why someone may be having recurrent episodes of vomiting. Some people have episodes of vomiting that happens infrequently, like it might happen for a couple days at a time every few weeks or every couple months, and it just comes and goes, and there's not really a clear rhyme or reason. Medicines don't really help it get better or worse. And in Western medicine, you may not be able to ever get a clear diagnosis. You may not be able to find out why. So those are some types of cases that we get at our clinic. And I wanted to talk a little bit about specifically ginger in the use of vomiting. Now, in Chinese medicine, ginger is a very important herb. It's an herb that is considered hot, so it helps to warm the body. And a lot of cases of vomiting can be attributed to cold inside. So we call it cold in the interior. And specifically, the organs that are often related to nausea and vomiting and have coldness is the spleen and stomach in Chinese medicine. Now, that's a little different than the way we think about the spleen and the stomach in Western medicine. So sometimes I tell patients this, and they think, oh, what's going on with my spleen or what's going on with my stomach? I just had an endoscopy. Everything looks okay. And it might look okay, but what you're thinking about is the anatomical spleen and stomach. But Chinese medicine is much different. It's looking at the meridians and the pathways of the spleen and the stomach throughout the body. And so the spleen in the stomach is an organ that likes to be kept warm. It prefers warmth and it prefers dryness. And a lot of times we can develop cold in the spleen and stomach. This could happen for a variety of reasons. It could happen from a viral illness or being out in the cold. It could be happen from um, drinking too much cold fluids or icy cold drinks or eating lots of cold type foods. There could be a wide variety of reasons why cold develops in the spleen and the stomach. It could be related to weaknesses of the kidney and of the yang energy of the body. A whole host of different things can cause coldness in the spleen and the stomach. Now, I said ginger is specifically a herb that is used because it's a warm and sometimes even a hot type of um, herb that's classified as warm or hot in Chinese medicine. And the interesting thing about ginger is it especially targets the spleen and stomach in Chinese medicine. And even outside of Chinese medicine, a lot of times you may have come across just folk remedies or just things your parents or aunts or uncles told you, like if you were feeling nauseated or vomiting, they told you, oh, take a little bit of ginger. So even in other cultures outside of Chinese medicine, ginger has been recognized to be good for the stomach. And so now the unique thing about Chinese medicine is that we actually have to differentiate what's going on and whether you are having cold, because sometimes you could have heat in the stomach and in the spleen, and that's causing your nausea and vomiting. And in those types of scenarios, taking ginger would probably just make things even worse. And so you have to actually diagnose whether there's cold inside the body, whether the spleen and the stomach is having cold, and if that's what's causing the nausea and vomiting. And so there's three, not just three, but there's a few different types of ginger. And common ones are shengjiang and ganjiang. Shengjiang is fresh ginger, and it tends to be a little bit more what we call dispersing, and it's very acrid and aromatic, um, and sometimes if you just smell it, it can open up your passageways. And then ganjiang is much hotter. It's actually even warmer than shenjiang, and it can be really used for stubborn cold. The third one I was going to just mention briefly today is Gao Liang Jiang. And Gao Liang Jiang is it's a ginger from a specific part that's grown in a specific part of China. And Gao Liang Jiang is very similar to the other types of ginger, but it's unique in that it tends to focus a little bit more on the interior. It doesn't disperse the exterior as much. And it also is, it's not necessarily as hot as ganjiang. So um, it can also be used, but really you want to differentiate what type of cold is happening in the body, whether it's the spleen, whether it's the stomach, whether it's both. Sometimes there can be dampness or phlegm that's also mixed with it. It could be heat, in which case you would not want to use ginger. So there's a whole wide variety of different things that can be causing nausea and vomiting. But um, ginger is a very commonly used one. We use it very frequently in our clinic for patients, and not just for nausea and vomiting, but other types of illnesses that can arise from cold in the spleen and in the stomach. And so, if you've had recurrent episodes of nausea and vomiting and you don't know where it's coming from, you've done endoscopies, seen doctors, done blood work, done x-rays, CAT scans. A lot of times in Western medicine, it can be frustrating because you just can't get a clear answer. And in a lot of those cases, Chinese medicine has some really good treatment options using acupuncture and herbal medicine and herbs like ginger. And so that's a little bit about recurrent nausea and vomiting, and we will see you next time.